Diverticular disease is a condition in which small bulging pouches develop in the digestive tract. It is most common in Western and industrialized countries and affects approximately 5 to 10% of the population by age 50. Incidence of diverticulosis increases with age. Some estimates are as high as 65 to 70% in persons older than age 85. In this video, we will explain the physiology of diverticular disease, the role of nutrition in developing it, and the differences between diverticulosis and diverticulitis. Diverticular disease develops when changes to muscular contraction cause feces to be trapped in the colon, exerting excessive pressure against the wall of the colon. This pressure causes the development of pouches called diverticula in the descending and sigmoid colon near the rectum. The changes to muscular contractions are associated with several factors. Age seems to be the primary reason for diverticulosis. However, long-term changes in dietary intake during human evolution may have contributed to the onset of this disease process. The introduction of processed refined grains over whole grain and poor intakes of fruits and vegetables rob the diet of fiber, which is necessary to stimulate muscles of the colon and keep feces moving through. Constipation results, placing unnecessary pressure on the colon walls. There are two categories of diverticular disease, diverticulosis and diverticulitis. The best way to remember the differences is through the suffix on each term. Osis means the condition of, and itis means inflammation. So diverticulosis is the condition of having pouches, and diverticulitis is an inflammation of those pouches. The presence of these diverticular pouches do not normally have any symptoms, although some may experience pain. It is generally diagnosed with a colonoscopy. Treatment includes keeping feces moving through the colon by preventing constipation and straining that can lead to complications like diverticulitis. When contents do not move freely through the colon, food and bacteria can collect in diverticula and become infected. Complications include development of bleeding, abscess, obstructions, fistula, or perforation. Pain can be quite severe and is usually located in the lower left abdominal area. Diarrhea is often present. There are very big differences between diverticulosis and diverticulitis, especially in how we treat it. As you ponder these differences, use your course resources to consider how diet can be used in each condition. In other words, how does diet differ in treating diverticulosis by keeping the feces moving through the colon and stimulating regular bowel movements, compared to diverticulitis where bowel rest is needed to allow healing in the colon?